We've just had another COP agreement where the wealthier countries are agreeing to send more money to aid those who need more assistance to tackle climate change. Obviously, for many people, they will see that as a great idea, but some of our viewers might be thinking, hang on, we're in a cost of living crisis here at the minute. Our debt interest payments are soaring. Can we really afford to do this?
Well, the detail is still coming in. That was obviously agreed overnight, so we need to look at that detail as we get more information. But of course, the UK, through its overseas aid budget, has always played a role in terms of tackling climate change, supporting countries around the world in terms of the measures they're taking. So we need to look at whatever's been agreed in the wider context of our international aid package.
Now, I want to talk to you about the NHS. There's lots I want to talk to you on that. However, before we do, the Sunday Times is reporting on Brexit that the government is considering a Swiss-style relationship with the European Union. Now, that would mean relatively frictionless trade, but it would also mean paying more money into the EU budget and almost certainly higher immigration plus an increased role for the European Courts of Justice too. Do you recognise these reports?
No, I don't. And if you look at the autumn statement, what the Chancellor set out was our determination to maximise the Brexit opportunities in high growth areas, whether that's in green industries, whether it's in life sciences, whether in financial services. And in fact, there were specific announcements in the autumn statement in terms of Solvency II. We've got a Prime Minister who himself supported Brexit. I myself did and was Brexit Secretary and worked very hard to maximise our control of our laws, our borders and our money. So it's absolutely important that, particularly in those high growth sectors, such as financial services, life sciences and the green industries, that we really use the Brexit freedoms we have. And so I don't recognise this story at all.
Could you ever support that kind of agreement?
Well, I don't support that. I want to maximise the opportunities that Brexit offers. That's what I worked for as Brexit Secretary. And as the Minister responsible for life sciences, I see huge opportunities for the UK in being agile, in moving at pace and having a regulatory system that is absolutely tailored to the UK needs. At
the same time, Jeremy Hunt has said that he wants to remove the vast majority of trade barriers with the EU. I mean, if you're really serious about doing that, then this is the kind of thing you need to look at, isn't it? Well,
the point is it's in both sides' interest to remove barriers. We trade with each other, we're important partners to each other. So that's mutually beneficial. And of course, we want to work constructively with EU partners to do that. But that's not at the expense of maximising opportunities in high growth sectors. And the autumn statement signalled our determination to do that, for example, with the announcement on Solvency II.
I just want to talk about the autumn statement with regards to Brexit, because the Office for Budget Responsibility, the official independent watchdog, were pretty clear on what they thought about it. They said that Brexit will result in the UK's trade intensity being 15% lower in the long run than if the UK had remained in the EU. The latest evidence suggests that Brexit has had a significant adverse impact on UK trade. And going on to say, via reducing both overall trade volumes and the number of trading relationships between UK and EU firms. Do you accept that Brexit has had, as the OBR says, a significant adverse impact on UK trade?
Well, I think there's dangers in looking at one little bit of the ledger in isolation. If you look at the vaccines rollout, whilst technically, legally, an EU member could have done things differently, I think culturally would not have done so.
Well, the question is, do you accept Brexit has had a significant adverse impact on UK trade?
Well, I think there's pros and cons, and the point is we have opportunities.
So that would be a big con, wouldn't it?
We have opportunities through the divergence opportunities I've just talked about, things like Solvency II, to get those pension funds investing in levelling up communities, better reflecting the needs of our financial services market.
On trade, specifically, do you accept Brexit has had a significant adverse impact on UK trade?
Well, what I'm saying is you've got to look at the issues in terms of Brexit in the round. There are areas where there have been difficulties in terms of greater friction, and we're looking to work constructively with EU partners on that. But equally, there are very significant opportunities as a result of Brexit. I don't think we would have done the vaccine rollout in the way that we did had we remained a member of the EU.
It sounds like...
And the significant regulatory opportunities we have, and the autumn statement signalled our determination to take those.
You're clear on what you see to be the kind of positives and the opportunities, but do you accept it has had a significant adverse impact on trade?
What I'm saying is there's pros and cons. It's very hard to model.
It's a very specific
It's very
question.
hard to model exactly what the impact would be. For example, we've just been through
the
pandemic.
OBR's done that, haven't they?
Well, of
They've
course, but
I
know from my time when I was Brexit Secretary just how difficult it is to model these things. Of course, we've been through a pandemic. That has had an impact. There's a range of things. But the point is, what matters is we maximise the freedoms that we have, take those particularly into the high-growth sectors, such as in digital, life sciences, green technologies and financial services. And the Autumn Statement signalled our intent to do so.
OK, now I do want to move on to the NHS, such an important issue. Many of our viewers will be really concerned about it. If I may, I just want to play to you what happened when our correspondent Fraser Ward went to Rochdale for this programme to ask people about their experiences of the NHS.
A lot of people go into A&E because they can't get a doctor's appointment, so then they're waiting 9 hours in A&E, which is ridiculous. I was a nurse, and I do think the standard's gone down an awful lot since I was nursing.
A lot could be done to improve it. I think it's struggling. It's pushed for funding. You're having to wait for appointments a lot longer than you were before.
There's not enough doctors. The waiting times are too long. I took my daughter there last week. We were sat in there for 6.5 hours. More staff. We need better staff. The waiting times, just for everything, is too long.
As far as the doctor's surgeries goes, can't get an appointment. It's shocking at the moment. I live in Milnrow, and my doctor's surgery, you can be on your last legs and you can't get an appointment.
What's your response to that?
Well, when Jeremy Hunt and I were last in the Department of Health 4 years ago, we put in place the biggest ever increase in medical undergraduate training, a 25% increase. Those doctors obviously take time to come on stream. They'll become junior doctors in 2024. So that gives an indication of our commitment to boosting numbers. We've got 3% more doctors this year than last year. And we're looking also at how we boost the wider primary care staff. We had a manifesto commitment on that and we're on track to deliver it. But I recognise as a consequence of the pandemic, GP appointments have been under pressure. We are seeing more people, 90,000 more G appointments this year than last year. We're looking at what technology we can offer, some things like cloud telephony, so we avoid the ATM sort of scramble of calls to a GP on a Monday morning. So it's about the technology we put in place, it's about the wider skills and boosting those numbers in primary care, but it's also about boosting the numbers of GPs, and that's what we did by opening 5 new medical schools where students started in 2019, but obviously there's a time lag in those coming on stream.
They're talking about doctors there, they're also talking about A&E, and I just want to show you the latest waiting times graphic for A&E. It's pretty shocking. You can see there, this is the number of patients waiting more than 12 hours in A&E, hitting over 43,000 in October. Now, I showed the same graph to Jeremy Hunt when he was on the programme, and I put it to him that, this looks like a health service on the brink of collapse. He said there are massive pressures on the NHS, and I think that doctors and nurses on the front line are frankly under unbearable pressure, so I do recognise the picture you say. I mean, do you think the NHS is on the brink of collapse?
Well, what that graph shows, you can see, for example, firstly, that it's very much driven by the pandemic in terms of the huge pressure.
I'm just asking about
Well, let me come on to
what the situation we're in now.
Of A&E. Yes, and I recognise, particularly for staff, they're under huge pressure in NA, nurses, doctors working phenomenally hard, given what that graph shows. That is why, in the Autumn Statement, we prioritise, in particular, social care, 2.8 billion next year, 4.7 billion the year after. In 2024, we'll have £8 billion going into health and social care. And the reason we prioritised both health and social care is because of delayed discharge.
Do you accept?
13,500. If I can say
okay.
the key issue, when you see that graph, the focus tends to be on A&E or ambulances. What is causing that graph is the 13,500 delayed discharge, which often links into social care. And that's why we've targeted funding, a very significant amount of funding at a difficult time, into social care so we can tackle that delayed discharge, which ultimately is the way we get the times down in A&E. Just
briefly, because you talked a lot about what you want to do, and I'll talk about your extra decision-making when it comes to quangos or bonfires, or the pen pushers, as the Mail is putting it. But before we do you accept there is a problem with the NHS right now, that it's not acceptable?
Well, I accept it's under huge pressure, and that's because of the pandemic. Let me give you one example. The number of 52 waits for operations was 1,300 going into the pandemic. It's now over 400,000. So this is because of the pandemic. We face huge pressures. That's primarily the cause. What we've done is target things like delayed discharge, which is the way we get flow into hospitals, which is critical for shifting those numbers.
Now, the NHS got £3.3 billion of extra funding in the autumn statement, but according to the Mail on Sunday, you're calling for a bonfire of the NHS pen pushers. What does that mean? Well,
we've got 6.6 billion over 2 years, but it's important that we get maximum value for money from that. And if I look, for example, at the centre, at the Department of Health and its arm's length bodies, they collectively cost £2.8 billion. And I think the scope for us to look at what the costs are in terms of administration in the NHS, have fewer targets, devolve more decision-making.
On targets?
We now have the integrated care boards that can look at issues on a population basis, a much more localised basis. What I want to do is give more autonomy, more freedom to trust leaders, to our ICBs, so that they're not spending so much time managing upwards, which in the feedback they give to me is a constant source of frustration for them. So let's have a more streamlined centre, develop more decision-making to those on the ground. That's a better place to assess
Just want to talk about targets, because you say that you want to cut hundreds of targets, but, you know, targets are the way we monitor NHS performance, right? You know, the graph that we just showed on A&E waiting times, that's how we know there's an issue with A&E. It's frankly how people like me can hold people like you responsible. Is there not a place for targets in the NHS? They're important, aren't they?
Well, there is a place for targets, but if everything's a priority, nothing's a priority. And risk, in my view, is best assessed on a population basis through the ICBs by local leaders. They're better able to tailor the priorities for the local needs, and we will have information such as through the federated...
Targets are important, right?
Of course, and no one's suggesting we don't have any targets. But what I'm saying is there's £2.8 billion.
Do you want to get rid of the targets such as the A&E waiting times?
No, I think the A&E is a very useful target in terms of actually the wider system health within the NHS, and it speaks to flow, which is a key issue in terms of ambulance handover delays and people waiting in A&E.
Now, another big issue for you is strikes. The Royal College of Nursing striking for the first time in its history. Now, you told the Sunday Telegraph their demands are unreasonable and unaffordable. What would be a reasonable pay rise for nurses?
Well, what they're asking for is 17.6%. That would be an extra cost for £9 billion on the NHS budget. That, for your viewers, is around 3 times more than those outside the public sector are receiving, and that's why I think that is unreasonable. And of course, whilst pay is important, it's important to look at the package in the round. The NHS contributes a fifth of a nurse's salary into the pension. With their contribution on top, that means a quarter goes into a nurse's pension, 33 days plus of annual leave. So it's important to look at the package as a round.
What would be a reasonable pay rise? Do you think nurses' pay should keep up with inflation?
Well, we have a process to answer that question, which is the independent pay review body.
Yeah, but we know that you can comment on pay because you've just described their demands as unreasonable and unaffordable, so we know you can give your opinion.
Well, and my opinion is we have a process through the independent pay review body. That is why last year nurses got 3% when the rest of the public sector had a pay freeze. We have a process through the independent pay review body to look at these issues in the round. And of course, Sophie, it's not simply about pay. When I speak to nurses, they also talk about the estate. That's why we're investing in 40 new hospitals. That's why we've got a significant capital programme around the surgical hubs, the diagnostic centres. It's also about technology. One of the bugbears nurses tell me is often when the tech actually makes their job difficult and we haven't got the right tech in place. So it's not just about pay, it's about the wider conditions, and that's why I'm very keen to engage with the trade unions. I saw the General Secretary of Unison this week. I had a round table with union leaders. I met the RCN also last week. So my door is open. We're engaging with the trade unions. There are other factors alongside pay that we need to discuss. But we do have a process through the independent pay review body to look at these issues.
Now, this week, like so many of us, I've been really touched by the story of the little boy, Awab Ishak, the 2-year-old who died after he was living in a mouldy flat. We know, of course, the boss of the housing provider has resigned. Does the government need to look at itself as well? I mean, how are we living in a country where a 2-year-old boy can die from the housing that he's living in?
Well, it's heartbreaking, isn't it? And aside from being a minister, I'm also a parent. You know, I've got 2 young children, and I think anyone sort of looks at that, you know, regardless actually whether they're a parent or not, but I think just as citizens we look at that story, and, you know, it's a terrible story, and it's clear that it needs to be followed through. We need to look at what lessons there are. Clearly there were failures in terms of the way the local council acted. I know it's something that my colleague Michael Gove is taking a very serious look at and is very interested, and it's something that's heartbreaking for us all to see.
Do we need to really focus on housing at the minute?
Well, I think we need more housing. We need to boost that. I think that's important to intergenerational fairness as well. But I think boosting housing is separate to what were clearly some failures here, where the family had raised concerns and those were not acted on. And we need to look into that.
Just finally, World Cup starts today. There's been some concerns, of course, about Qatar's treatment of women, the LGBT community, and also, of course, the migrant workers, many of whom were working on these stadiums. And yesterday there was this extraordinary press conference from the president of FIFA who said that the one-sided morality lesson is just hypocrisy, and he said that Europe and the West should be apologising for what we've been doing for 3,000 years around the world before giving moral lessons. What's your response to that?
Well, it's an international major event, and I think all of us are excited. We firstly wish the England team well. And also, just on the subject of sport, a huge shout-out to everyone in Rugby League. I think the tournament that they've just had, both the men's, the women's, the wheelchair, has been a fantastic showcase for sports and for Rugby League in particular. But obviously, in terms of Qatar, it's important that we engage. I think everyone will want to get behind the team. And it's a major tournament that we're very much looking forward to.
James Cleverly, the Foreign Secretary, said fans should respect the law of the home country. Is he right?
I think people should respect the law, whether that's overseas or in the UK.
Even if you don't agree with it, I mean, you can go along with it without respecting it.
Well, I think the law of the land, wherever you go, it's important to respect, yes.
OK. You're going to be watching the World Cup?
Of course.
Who's your money on to win?
Well, like you, I think we all want England to win, and, you know, that's what we're backing.
Yeah, I definitely want England to win, but I'm not sure that's where my money would be going, I'll be honest. Thank you very much for being on the programme today.